So today we have Dr. Arjun Khanna, who's been specializing in infectious diseases for last 12 years, and he would tell us that how would our body respond to the vaccine.
Thanks for having me here, Mahi. I am a pulmonologist, so I deal with diseases of the lungs, and I have special interest in pulmonary infections, and I have been in practice for the last 15 years, and I'm currently a senior consultant at Yashoda Hospitals in Ghaziabad, where I take care of patients who are suffering from COVID and other respiratory infections.
Thank you, doctor. So I can proceed with the questions?
Yeah, please go ahead.
Knowing the current scenario, everybody has been vaccinated. So how do we know if our body has responded well to the vaccine?
There are multiple tests which are available. So the tests, they hover around checking the IgG levels in your body. The IgG is basically an antibody. It is what is produced by your body in response to an infection, right? So the IgG levels are going to be high, whether you've been infected with the natural infection or whether you've got an antibody. But the kind of IgG that is going to be present is going to be different. If you have had the natural infection, you will have antibodies against both the nucleocapsid. On the other hand, if you have received only a vaccine and you've not got the natural infection, you're going to have antibodies against the spike protein. So what we try to measure, or what we should be measuring, is actually the spike protein, because the spike protein is the one which causes the disease. So antibodies which are against the spike protein are going to be the protective antibodies. So if we have a reliable measure of the antibodies against the spike protein, they would tend to portray the anti-infective power that is there in our body in a better manner.
Doctor, why is it important for one to understand the body's immune response to the vaccine?
Everyone talks about immunity this day. Post-COVID, I think it's the hot topic, and everyone comes to us asking how to increase our immunity. We always tell them there is no formula, there's no medicine which is going to increase your immunity. You need to eat well, you need to sleep well, you need to exercise. And if you want us to give you an objective measure of your immunity, well, there are not many tests, but if we talk about COVID specific immunity here, probably the best test is to go for tests, which measure your antibody levels. Now, I would want to, say here again, Mahi, that there is no linear correlation. If I say that your antibody levels are, say, this much and you'll be protected against COVID, no, that's not correct. So we still do not know what is the correct measure of the antibody levels against which, if you have that, you're going to be absolutely protected from COVID. We do not have those values yet. However, we are in the process of developing that. And as we get more intelligent about this disease, as we understand this disease better, probably in the time to come, we'll have exact tests which are going to tell us that whether or not we are already immune to this virus. So the future looks bright. And as we understand this disease more, we'll have the absolute correct answers for you.
Doc, I wanted to know about the Quant IgG test and if it's available for everyone and what we should keep in mind while taking the test.
Absolutely. I'm going to use a few medical terms here. I'll try to simplify it as much as possible. Your immune system is basically of two kinds: a B cell immunity mediated immunity and a T cell mediated immunity. Now, the B cells are the plasma cells which are present in your blood. And when we are talking about IgG measurement, this is basically antibody measurement. What the immune system, what we are trying to measure with the antibody based tests is basically the B cell function. When you get an acute infection, say, if I get COVID today, my body is going to produce antibodies which are known as the IgM antibodies. And after a couple of weeks, what my body is going to produce is known as the IgG antibodies. So what the IgG, yeah. So what the quant is for quantitative, and this IgG is going to be produced after 2 weeks of infection from the start of infection. Now, the beauty of these tests is, especially the quant IgG test, is that it has been validated with a number of studies. When we talk about any medical test, the test needs to have a good sensitivity and a very good specificity. The data with quant IgG tells us that the sensitivity and specificity is excellent with this test. So if you have the antibodies against COVID, most probably this test won't miss it out. However, what everyone needs to understand is that if you have COVID antibodies present, your test is positive for COVID antibodies, that does not by any way means that you're not going to get this infection again. So we don't want to instill a false sense of security in people. So even if your antibody titers are high, even if we have done the quant IgG, which at present is the best test available, you still need to maintain social distancing. You still need to wear your masks. You still need to wash your hands. In no way are we saying today that if your antibody levels are detectable, you are immune from COVID. That does not work this way. As of now, we do not have tests that are so, robust that would, point this out. We need time for that. So take care of the general precautions, most important.
Which is wearing masks.
Absolutely.
Which people are avoiding nowadays.
Which is very unfortunate. You go out and you see people not wearing masks. Social distancing has gone for a toss. We are inviting trouble. And in fact, in the first few days, we have been seeing an upsurge in the number of COVID cases. Thankfully, most are mild, but this should have not had happened, right?
Doctor, how do we understand if the body has developed enough antibodies, and what are the next steps?
Coming back to this again, even if you have antibodies, that does not make you immune from this infection. This disease, this virus, produces antibodies, or when you are exposed to this virus, either in the form of a natural infection or a vaccine, what we are noticing right now is that the antibody levels, they tend to wane off after a period of time. That is why, the need for booster doses. So the issue with COVID as of now is the antibodies, they tend to wane. So though we have good tests which are available, which are going to tell you your exact, status about the levels of your antibodies. But if you have these tests as positive, it is good. It tells us that your B cell immune system is working fine. Your body is releasing the antibodies, but please do not let your guard down. And that is extremely important.
So this is one confident way of me and my family to welcome Zindagi as we head back to work, shoots, and plan our next vacation. Thank you, Dr. Arjun Khanna, for your time and for the information. Thank you.
Thanks for having me here, Mahi. And let's hope that's the end of COVID and we're all out of it now. Thanks.